Hello, welcome to my YouTube channel. This is Lamek, and today we want to talk about depression. First of all, I want to explain what is the depression. Depression is a constant feeling of sadness and loss of interest of the things that you used to do or used to like. For example, you used to like maybe watching a football match or playing soccer, but you've lost the interest of doing so. Then it means you've lost the interest. Before I explain the treatment of depression, allow me to talk about causes of depression. One, living in abusive marriage. This means if you are two people cohabiting or living together, one is abusing the other. It can be emotional or physical abuse. Then this can lead to depression. When I say physical, this physical fighting. And when I say emotional, this can be utterances of some words that can mean to demean you. Then that's emotional abuse. Another thing is loneliness. Loneliness can lead to depression because when you tend to be lonely, it means you lack somebody that you can speak to, somebody that you can share to. And what I know, sharing is caring. If you don't share your stories or your issues to people or your friends, or maybe a counselor or a psychologist, you are being lonely. So being lonely can lead to depression. Third, prolonged work stress. Prolonged work stress, this means that maybe you've been stressed at the workplace for so long that you cannot even carry the burden anymore. Can lead to depression. By this I mean you can be given job targets and you don't meet those targets, and then you live with those unfinished or reaching the targets for so long. It can lead an individual into depression because you are not meeting the demand of your employer. Fourth, abuse. Abuse can be emotional abuse, can be physical abuse, and it can be sexual abuse. When I say physical abuse, is the fights that we all see people do. When I say sexual abuse, I mean starvation of sex, rape, and such like. When I say emotional abuse, this is the time you are emotionally abused. You are not balancing the emotion of you. And there is another cause of depression, age. Old people tend to be living lonely. And when you live lonely or maybe in a cocoon, this can lead into depression. Because in a nutshell, you don't share your stories, you don't share your issues, you're just lonely. Another cause of depression, death or loss of someone that he or she was dear to you. This can cause depression. How does it cause depression? This person, you are intact, you are emotionally connected, and now you've lost that partner. It means you will not have somebody to talk to. Maybe that somebody was your confidant and now he has gone. It means you will not be having somebody to talk to. Another issue that causes depression is genetics. When I talk about genetics, I mean family. If maybe one of your relatives used to be depressed when they were very young, and now it can pass from one generation to the other. For example, if maybe one of your friends, one of your relatives is used to be depressed about such issues, and then when it comes to you, you can be depressed like that. Giving birth or pregnancies, people get depressed because they plan or they arrange after 9 months they are going to have babies, and when they go to the labor room, they don't come out with babies. What does it mean? They will be stressed because they had planned physically, emotionally, and mentally. So if you don't meet all those, you go into depression. Alcohol and drug abuse is another major issue that causes depression. People tend to cope with drinking alcohol and taking drugs so that they can fade or forget their stress, not minding that they will be stressed more and they go into depression. Another thing that causes depression is personality. Those people with low self-esteem can tend to be more depressed because they don't believe in themselves. So a major issue can make an individual go into depression. Another major cause of depression is illness. Those people who are sick, long-term illness, I mean, like cancer, HIV and AIDS, and such like coronary diseases, can make people go into depression because they think a lot. They think a lot. So if you think a lot about you yourself and you with low self-esteem, then it means you will be sick. Sick means you go into depression. Now the last cause of depression is past trauma. Past trauma is just past experience that you underwent when you were young kids. Now this past experience will come from what you experience up to now, and then you'll be depressed. Now I want to talk about symptoms of depression, because we've talked about causes of depression and there were 12 in number. Now we want to talk about symptoms of depression. And these symptoms of depression we are going to talk about 5 areas where we look and determine that an individual is suffering from depression. First, we look at the mood. When we look at the mood, we look at the anxiety of an individual. We look at general discontent of an individual. Individual can be guilt, an individual can be hopelessness, an individual can lose interest of activities that they used to like. An individual can have what we call mood swings. Now those are areas where we look on mood. Now if we go further, we go into behavior. We check on the behavior. Behavior, these people, they are very much agitated. They cry a lot. They are restless. And they also social isolate. They social isolate. When we check on sleep, they early awakened. They wake up very early. They are very early in the morning. Others sleep. They have what we call excess sleep. Others go into restless sleep. When we check on the whole body, we check on the excessive hunger, fatigue, or loss of appetite. These people, they look so tired. You cannot even think that these people, they are once energetic. They are very tired and they don't eat. They lose appetite. When we talk about the mind, now we check on the cognitive part of the brain. When we talk about cognitive part of the brain, these people, they lack concentration. They are so slow in activities that they used to like. They think of even suicide. When we check on the weight, these people, they either gain weight or they lose weight. Either can come. And also, the major cause of depression is loss of appetite. These people, they don't eat. They don't eat, but they can hard weight, but they don't eat. Now we want to talk about treatment of depression. Treatment of depression. 1. If you think or you imagine that you're being pressured a lot about the job, take things slowly. Don't push yourself to achieve what you cannot achieve. Do things one at a time. Another treatment, exercise, go to a gym, play with your friends, eat well. You will come out of this depression. If you're that person who doesn't relax, please take time, relax, sleep well, so that you can come out of this depression. Another thing, if you discover yourself that you are not doing what you used to do, go back and start doing them. Because if you don't do them, you will be sick more. So what you'll do, go back and start doing what you used to do. Last but not least, depression, it's a serious disease. If you've never thought of going to see a counselor, please do. Go to the hospital, counselors are all over. Talk to them. They will assist you. Thank you for listening.